Now we're going to move over to Charlie Angus for your 7 minutes. You've got the floor,
Thank you,
Charlie.
Madam Chair. Thank you for having me at your committee. Thank you for your witness testimony. You said that you've been engaged in this issue for a bit of time. So when did you officially begin to look into the issue of forced sterilization of Indigenous women in Canada?
Oh my goodness. I mean, I would say last fall is when we started in 2017, really looking at it in a specific way. We've been looking at cultural safety and humility and racism in the healthcare system and the TRC calls to action much prior to that.
Okay, thank you. I guess I would have said I would be really shocked to have found that women are being forced to be sterilized in hospitals in the north and different communities, unless, of course, someone's actually seen what happens and the complete inequities faced by Indigenous people, that this kind of behavior is actually not all that shocking. I think what's shocking is it took the United Nations, their report on torture, it took a class action lawsuit to get this kind of issue brought to the fore. So in October 2017, right around the time you said you started to deal with this, that's when the class action lawsuit that named the federal government was brought forward. So were you aware of this before the class action lawsuit, or was it not a priority? Like, how did the class action lawsuit push your department into starting to address this and look at the cases?
I think it was just the fact that the practice is being reported to still being occurring today. I think that was something that was of significant concern to us. Within our department, we no longer run hospitals outside of 2 hospitals in Manitoba, and in those hospitals, we don't have surgical procedures. So I think for us, learning that this was still something that was ongoing in the healthcare system was of particular concern.
Right, because measures to prevent births within national, ethnic, racial, or religious groups are prohibited by the Convention on the Prevention and Punishment of the Crime of Genocide. The UN has brought forward very specific recommendations for Canada, including a call that the names of those who've been involved in this behavior be turned over. So as a defendant in this lawsuit, would you be knowing of the specific cases where women have been forced sterilized? Are you willing to comply with the UN call to turn over the names of people who have been engaged in this practice to criminal sanction?
I really can't comment on pending litigation, and again, it's not my area of expertise with respect to that piece of the litigation.
Have you taken any steps to hear directly from women who have been sterilized so you can have a better sense of the inequities and the abuses that are happening within the system?
So we've been discussing with national Indigenous organizations how to approach that, how to approach either research or outreach in a culturally safe way. I think that this is our first meeting of the advisory committee, which is planned next month. This will be part of our agenda. I've had some preliminary discussions with the organizations, but I do think that it's important to reflect on what will be the best approach. Even in the external review that was conducted by Senator Boyer and Dr. Bartlett, they noted the difficulties in having women come forward and the fears that women had, and the fact that they did believe that there were other women there, but they were reluctant to do so. So I do think that the approach that is undertaken, we do have to, if possible, have the support of Indigenous women's organizations so that they can play an important role in the outreach.
Has your department issued any statements to anybody involved in First Nation Inuit Health Branch, any of the hospitals where women are being flown out to receive treatment, to say that forced sterilization is a crime, that it meets the international conventions of torture and genocide? Have you issued any statements warning any of the hospitals where Indigenous women who are under First Nation health services are being treated? Has any warnings been sent out?
We have not issued any specific statement. We have, however, discussed with Indigenous women's organizations providing funding to develop materials for women and for healthcare partners in order to be able to raise awareness about the issue and also provide culturally safe guidelines overall with respect to Indigenous women's reproductive health.
Yeah, I guess I'm concerned because, when the UN Committee Against Torture names Canada and demands immediate action, to me, that's a very shocking thing for our nation. We're not talking about, good moms and healthy babies programs. We're talking about a crime that fits the Convention of Genocide. So having been made aware of it roughly around the same time that a class action lawsuit was launched against the federal government, I would think that there's going to be some clear steps in place. So what are we going to see from the federal government? We know that the government's rejected the UN call to criminalize this behavior. What concrete steps will you ensure to make sure this doesn't happen again? Because we've seen that it's happened in Manitoba, Saskatchewan, Northern Ontario. If we keep looking, are we going to keep finding this practice? What steps, concrete, to say that this will never happen again?
I think our main role will be to convene federal, provincial, territorial partners, mainstream health organizations, licensing bodies of medical professions, medical associations, in order to be able to collaborate on essentially what will be a series of preventative measures, and also to redress racism and discriminatory practice in the health system where they exist. I think having Indigenous women's organizations play a leadership role in that is extremely important.
Yeah, I guess because last week the First Nation chiefs issued a resolution calling on the federal government to change the criminal code to explicitly outlaw coerced sterilization, because we understand it's happened as late as 2017, maybe later, we don't know. But yet you've issued no statements saying that this is a crime. So would you recommend to the minister that this should be considered a crime at the federal level, that we should have clear laws in place to make sure that this is going to stop and it will be treated with the seriousness that the UN has called for?
I think the Department of Justice has issued a statement on that issue that indicates that they are taking a public health approach. So we would definitely work with the Department of Justice.
The public health approach
is
is different than a criminal approach, right? Like, you keep talking about it as a public health issue, and I keep talking about it in the light of the UN and what the chiefs are calling, which is a criminal action. Are we going to see it referred to as a criminal action and not just a public health issue? Because forced sterilization meets the international convention rules on torture.
So again, I'm not from the Department of Justice, and I can't speak on behalf of the Department of Justice. The Department of Justice has spoken about the existing criminal acts that exist right now that will prevent forced sterilization and protect women through existing legislation in Canada. However, I really cannot go farther. I'm just not a representative of the Department of Justice.
Excellent. Thank you very much. And thank you, Mr. Angus.